Okay, introduction to cannabis, commonly known as marijuana, is a plant from Cannabicaceae family, primarily divided into three species, which is Cannabis sativa, Cannabis indica, and also Cannabis ruderalis. So, Cannabis sativa, it is typically taller with a narrow leaves, and it is known for its energizing effect. While for Cannabis indica, it is a shorter and bushier, and is often provide a more sedative effect. For Cannabis ruderalis, it is lesser known. It is often mixed with other strains to combine its unique properties. For example, cannabis has been used for thousands of years for its medicinal, recreational, and also industrial applicants. Ancient cultures in Asia, Middle East, and also Africa utilized the cannabis for its psychoactive effects, pain relief, and also as a textile fiber. For chemical composition, cannabis contains over 100 cannabinoids, with tetrahydrocannabinol and also cannabidiol being the most studied. Tetrahydrocannabidiol, it is responsible for the plant's psychoactive effects, while for cannabidiol, it is a non-psychoactive and known for a potential therapeutic benefit.
For the next part is the uses of cannabis. So this is cannabis health benefits. First one is anti-cancer effect. Cannabis was proven will increase the apoptosis rate and will enhance the effect of chemotherapy. The next one is cannabis also will reduce the anxiety level by reducing the blood pressure. And then cannabis also will increase has an anti-inflammatory effect by suppressing the immune system. And then cannabis also being used to relieve pain by reducing the neurotransmitter release in our body. And the last one is cannabis also being used as an alternative of alcohol and drug use. So this is some of clinical conditions that can use cannabis. The first one is inflammatory disease, include IBD, ulcerative colitis, and arthritis. The next one is multiple sclerosis. This cannabis being used in multiple sclerosis in UK and Canada. Cannabis also being used in seizure medications, anxiety disorder, and also drug and alcohol addiction.
Talk about mechanism of addictions, tolerance, and also dependence. Cannabinoids will bind to the cannabinoid receptor, which is known as CD1R. These are located at the presynaptic neuron, where we can find in GABA and glutamate neuron. This will reduce the release of GABA and also glutamate, where this lead to increase in dopamine release. Dopamine release in the reward center, they will cause addictions. Overusage of the cannabinoid, they will cause overstimulation of CD1R receptor. This will cause internalization of CD1R, and this cause tolerance, where they need to seek for more dose of cannabinoids. Continuous usage of cannabinoid, they will cause reduce the productions of endocannabinoid. This will lead to dependence.
About the effect of cannabis. So when it acts on the sympathetic nervous system, it will cause tachycardia. And then when it acts on the blood vessel to the eye, it will cause vasodilation, so more blood flow, so your eyes will be radiant, which will cause conjunctivitis. And it will act on the brain for like in hippocampus, it will act on it will cause impaired memory. So when you take a high dose of THC, it will cause hallucinations, and then if it's act on the hunger part of your brain, it will increase your appetite to eat more. And then if it's act on the cerebellum or basal ganglia, it will cause impaired body coordination. Firstly, we'll talk about increased appetite is the effects of the cannabis. So when you stop immediately, it will cause you craving. It's the opposite side. So, and for insomnia, it's basically cannabis disrupt your REM cycle. So when you stop immediately, your body try to adjust, so it will cause you some difficulties to sleep. And for depression and irritability, basically how it affects on the brain part, which will cause these mood changes. And for pain, basically because the cannabis has analgesic properties, so when you stop immediately, you will have a pain for a slight cut, so you cannot tolerate that too much pain because of regular use of the cannabis.
Assalamualaikum and very good morning. My name is Lydia. So I will be talking about cannabis poisoning. So cannabis poisoning can be divided into two, which is first acute poisoning and second is a chronic poisoning. So for acute poisoning, due to mild to moderate intake of cannabis, the signs and symptom is vague, euphoric state with drowsiness, motor inclination. So this signs and symptom is often seen in people that actually who takes drugs. So next is if the cannabis poisoning due to high doses of cannabis intake is the signs and symptoms will be nausea, anxiety, confusion, delusional, hallucination, frank psychotic reaction that will ended up into violence action. If the acute poisoning is due to IV administration, the patient will be having severe headache, blurred vision, vertigo, dyspnea, fever, hypotension, and worst case scenario is adrenal dysfunction. So for chronic poisoning, due to the cannabis itself, the patient will be having a psychotic behavior, and the patient also will be so aggressive. He or she might also have a motivational syndrome, whereby the patient will feel so lethargic and so unmotivated to do something, and the patient also will. So next, I'm going to be talking about cannabis poisoning punya treatment. Rarely life threatening, and it can be resolved by its own. But if the patient came to the hospital or something like that, the general practitioner will give supportive treatment and also counseling to the patient lah. So in severe cases, a close monitoring is needed to rule out any CNS depression. Okay, for in acute poisoning, if there's a cases of ingestion of cannabis, the cannabis need to be sustained by stomach washout or induced vomiting of the cannabis, and also the general practitioner also will give the patient activated charcoal to neutralize back the stomach. Next, if there is a psychotic manifestation, the patient will be given haloperidol. There is symptom like tachycardia, the patient will be given by benzodiazepines. If seizure, also give by benzodiazepines, and if there is a status epilepticus, the patient also be given benzodiazepines and also adequate sedation and airway management if necessary. And also psychiatric follow-up is given to the patient also. Chronic poisoning, we cannot just simply cessate the cannabis use just like that. We need to gradually reduce it because it will cause more irritability to the patient and make it the symptom worse. If the psychotic behavior is too much or the aggression is uncontrollable, the patient will be given diazepam. And also if there is also psychotic reaction, he or she will be given haloperidol and also psychotherapy treatment. That's all. Thank you.